French Hospital Medical Center in San Luis Obispo has been investigated by the State Department of Public Health over the level of care they've been providing to newborn babies.
In a report obtained by KSBY News, investigators said a failure in the hospital's state licensing had potential to put infants at risk. Hospital administrators insist their only wrongdoing was not filing the correct paperwork. We look into these allegations in this KSBY News investigation. On its website, French Hospital Medical Center says it offers advanced neonatal care for the tiniest of patients. But it's the level of care that staff was allowed to administer that came into question last fall. A complaint lodged with the Department of Public Health was found to be substantiated after an investigation on October 1st of last year. A statement of deficiencies report obtained by KSBY News shows French Hospital was operating as a Level 2 special care nursery, but failed to have a state license to do so. Hospitals can reach up to Level 4 status, treating the most critical infants. In the state report, the director of nursing is quoted as saying the nursery accepts infants greater than 32 weeks. The licensed nursery nurse said infants are provided with oxygen therapy, IV therapy, feeding tubes, nutritional fluids into the vein, and transfusions. Services typically performed in a Level 2 nursery, the report says. At the time of the investigation, the hospital only held a Level 1 or basic status, which allowed them to care for infants 35 weeks and older. The chief nursing officer acknowledged in the report these services are not on the current state license, and the director of nursing told the investigator the indication on admission policy that it is a Level 2 nursery is a typo. 32-weekers. We took the report to French Hospital CEO Alan Iftinuk.
So it was a technical issue. It was not a patient safety or quality issue. It was a technical issue.
Iftinuk says months prior to the investigation, doctors, nurses, equipment, and training were all put in place to start accepting babies 32 weeks and older. But in all the planning and prepping, they failed to get state approval.
We needed to do an application to CDPH. It's called a program flex that they take a look at and then ultimately approve. So that box did not get checked, unfortunately.
In the 1 month prior to the investigation that the unlicensed Level 2 nursery was operating, Iftinuk says one baby was treated. The state did order the hospital to stop accepting 32-week-old infants until it obtained its accreditation for Level 2 status. In a plan of correction issued by the hospital, also obtained by KSBY News through a Public Records Act request, it stated all patients under the age of 35 weeks gestation will be stabilized and transferred to a higher level of care. Iftinuk insists no patients were ever at risk, but one glaring statement by the state investigator says otherwise.
There was never any jeopardy for moms or babies.
Because in the investigation, it did say, and this was quoting the investigator, this failure had potential to put infants at risk.
Because it didn't go through the state for their final approval.
Hospital administrators have since applied for the correct licensing and were approved. As of January 6th, 3 months after the investigation, the hospital is now up and running as a Level 2 acute care nursery. And the hospital CEO and CDPH's investigation confirmed that no babies were being treated in the acute care nursery at the time of the investigation.